Medical schools not following the set standards to curb the spread of COVID-19 risk closure, according to the Minister of State for Primary Education, Dr. Joyce Moriku Kaducu. Kaducu this Wednesday visited Mulago Medical School to check on their operations, and our reporter has it in details here.
While issuing the directives during the lifting of the nationwide lockdown on July 30th, President Museveni listed medical students as a source of specialized human resources for the health sector. Last Friday, medical schools reopened as a measure to boost the country's number of health personnel involved in the fight against COVID-19. At Mulago Training School for Nurses and Midwives, classes and progress. The State Minister for Primary Education, Dr. Joyce Moriku Kaducu, and the Commissioner of Health Education and Training, Dr. Safina Kisumusene, visited the institution to check on how they are adhering to the set standards. Hand washing facilities, sanitizers and social distance were all in place.
Don't follow the SOPs coming tomorrow. But if you do very well, if you demonstrate that you are capable of following the standard regulations put in place during COVID, then that will open the door for the other colleagues who are still at home.
The principal of Mulago School of Nursing and Midwifery, Nampi Makakonge Eva, told UBC that students have been grouped into various streams to avoid congestion, adding that they are working hard to ensure all their students are fully vaccinated, besides studying in shifts.
Tried to maintain and to keep as the Minister of Health guideline, but the only challenges that we are having is the vaccination. And we've been assured by the director, Mulago Hospital, said that when they get the vaccines, they are going to give us.
We still hope tomorrow they are going to be given as per the pledge from the Mulago director. They are going to allocate some doses for the students and the tutors.
The minister urged all medical schools to follow the set standards to avoid possible closure.
What they are supposed to do. And by the way, they're exemplary because they are the ones going to manage the health of the people in Uganda. If they cannot manage to keep their own health, to keep the procedures, then how do we trust them to manage the people of Uganda, to take care of the health of the people of Uganda? So I call upon all the training schools, please, this time round, it's not going to be a joke. We're going to be strict. When we found you are not following the procedures, if there are no standard operating procedures, we rather close the school than subjecting the children to unsafe environment.
A total of 425 medical students, mainly finalists and second-year learners, have reported. The second group is expected in October this year. Other schools and learning institutions, together with places of worship, remain closed. Bernard Higa, UBC News.